Hi, this is Dr. Christopher Maloney. I wanted to talk to you today about back pain. Back pain, people typically, over a 10-year period, will actually assume that their back pain has gotten better. They'll actually, in retrospect, downgrade their previous pain. So they would say, oh, it was 5 out of 10. Then, 5 years later, they'll say, well, that was only 3 out of 10. Now I know what 5 out of 10 feels like. It's not the same. So, but if back pain worsens without treatment. Basically, what people will do is ignore it. They'll actually accommodate to a certain level of back pain. That's what the idea of downregulating is. And then once they've accommodated that certain level of back pain, they'll then assume that the new level is actually fine as well. So without treatment, it worsens, and these are all Cochrane databases I'm talking about. Surgery is the last option. You would expect there to be an enormous number of studies on back pain and surgery and back pain without surgery, but there are not. For them, overwhelmingly, what they'll do is do a surgical fusion or a change in the pain, and what happens is, based on that, the surgeries in many cases are not better than conventional or conservative treatment, which is basically just watching and waiting and having people do stretches. What happens is that you fuse one of the ligaments, you fuse one of the vertebrae, also take out a disc. You will isolate the pain out of that area, but what typically will happen is the person continues to move, and you're going to have increased flexibility above and below the fused disc. Those discs will then start to deteriorate because the person hasn't changed the way they work by working with their back. So for the most part, I would say that lifestyle changes can alter, and for the most part are the only real answer. Because if you get a surgical fusion of 2 of your discs and you go back out and lift the same way that you did before for the last 20 years, guess what? You're still putting way more pressure on that. Now you've got a big bone, basically 2 fused discs between 2 discs, but those discs are still going to get that same inappropriate weight, and you have to do that. You're looking at, okay, I'm going to have a lot of surgeries in my life, and I have patients who've had 12 or 15 surgeries and 15 fusions, and they really have no back left. It's just one big fused thing, and you'd say, well, that person has no pain. I'd say, no. What unfortunately happens, they still got some neck vertebrae that can get painful. They have the muscles around, at this point, have learned to hold. So you really are talking about something that you have to change the way you're dealing with your back. So the problem with back pain, and I think most of us have this at some point in our life. Hopefully it's transient, but you lift wrong, right? That's your easiest, simplest thing. You lift wrong, you tear a tendon or a ligament, you put extra pressure on a vertebrae, and you have basically what we call a trauma, and then that causes pain. Now, how you deal with that trauma is very important. So what happens is most people ignore it. If you ignore your trauma, what happens is you set up a chronic, ignoring is the muscles tighten. So let's say 6 months later, at that point, we just say that the trauma has healed, but the muscles have tightened now, and now you have a chronic back pain. Because the muscles have tightened in a way that's not appropriate for the rest of the body. And so what's going to happen is that, say the muscles, this is your head and your back. So let's say I'm lifting wrong. So you just go out and you say, I'm going to pick up a watermelon with one hand. And what you've done is you've actually pick up the watermelon with one hand, and you hurt your lower back on this side. So what happens is that then you ignore that pain. It heals up over 6 months, but guess what? The tension lines for that pain are now going up to the left shoulder. So now you've got chronic pain in your left shoulder. You're like, why don't I have pain in my left shoulder? Well, guess what? This got all very tense. These muscles got very tensed over here. They cranked you out on the back, on the right, and this left shoulder is now out of alignment. So if you look at me in the back, so I tighten that right, the left shoulder rises up, you now have this left shoulder not where it needs to be. I don't know, you throw a baseball for your kid, and suddenly now you've got pain up here. So now you've got chronic back pain in 2 locations. You've got the back lower right and the upper left. So you do that, and then so you're doing that, and taking care of those 2 things, and guess what? Now your right shoulder is the most mobile. So you injure yourself here because you're doing a lot of all your motions happening there. So you have these things, and then of course that exacerbates back to the original. So what happens is that people who ignore the problem end up actually making things worse and worse and worse. Don't ignore the problem. Let's say you did your stretches. You did your stretches and you did your exercises. And the ones that typically, the ones that we all like are the McKenzie's, which is basically a back extension exercises. Yeah, I think that's fine. Just type in McKenzie on any YouTube database. You'll find a bunch of studies on that one. So the McKenzie exercises, you do your stretches, and your back pain goes down. So it resolves. But guess what? It didn't actually. You didn't actually fix yourself. You lift wrong, and then but the reason you lift wrong again the second time, second, third, 20th, and now we're talking about degenerative disc disease, DJD. DDD. Degenerative joint disease is DJD. DDD, degenerative disc disease. So basically, what happens is that you've now traumatized that disc, which is a chronic trauma. Guess what? Now it's a chronic trauma. You've now got a disc involved. You go see your orthopedic surgeon. He says, "Hey, let's take that disc out." The problem is that you lifted wrong once and you didn't listen to yourself. You did the stretches and the things to repair yourself, but you didn't actually change the way you're looking at things. So the point there is you'd say, well, what should I do to take care of this beforehand? About the second, the third, the fifth, or the 20th time, you need to change posture. And we're not talking about, the only people who are typically getting postural changes are people in the military that are being told to stand up and back, which is not great for your posture. Very few of us are going to get any postural training. Maybe some women in dance, but dance typically has some strange postures as well. Men rarely get any postural training. So you really want to have a postural retraining. And the person who would do that would be a PT, but typically PTs are not taught to do postural training for people. They're actually just treating acute injury. So you're not likely to get a hold of get a referral to a PT. But you really want to change the posture and the way the person interacts with their world. If you don't do that, what's going to happen is that over time, that whatever traumas you have are going to get consistently worse. So there's a thing, postural change. If you're in pain, there's a postural change called neutral back. And this is the position that people will typically find when they're in pain. So if you're hurting on the right side and you've hurting that out, you're going to find your way, inching your way over to the left to try to find that postural change. You're going to find that place that it hurts less. But to find neutral back in any back pain situation and then maintain that after the back has repaired itself is going to be really helpful. The other thing that happens with the back pain and the trauma is that you have an overlay, emotional overlay. And this is what really stymies even people who are doing their exercises, is that once you have back pain, you don't want to deal with it, it's troubling, you want to go back to ignoring it, and so what happens is that you get a kind of emotional block. Oh, this back pain's hurting me, I don't want to deal with it, I don't want to deal with it. And so what happens is the body will retense those muscles and not eventually give you a feedback loop to your head. Oh, hey, we're tensing those muscles. So typically I'll see patients who 5-10 years ago have had back pain. They've done the stretches, they did everything, the back pain's still there. They don't have DDD, or they're starting DDD, but it's not bad enough to have surgery. But what they're having is an emotional tense response, and at that point you need biofeedback. Biofeedback is this process of, hey, this muscle is tight, I want to relax it. Look, I try to relax that muscle, it doesn't happen. What's wrong with the loop happening in my head that I'm trying to relax this muscle and it's not going on? So a lot of what I do is basically biofeedback. I say, hey, this muscle is very tight, this is a reason for it. And at this point I've actually gotten to a point where I can tell you what different emotions affect different muscles, because it's fascinating. People actually, we kind of have a visual picture of where we would like to put tension about different issues in our backs. So the idea is that if you're ignoring it, or you don't want to deal with the trauma, or you're having difficulty dealing with the fact that you're no longer able to pick things up, you're going to have an emotional overlay. That's going to tense the muscles as well, even if you've dealt with all the trauma, and you're going to need some biofeedback to deal with that. So neutral back, biofeedback, and biggest thing though is if you're in trauma or you haven't done your stretches and you haven't done you haven't done something to address this issue, you're going to get worse. And anybody who tells you different needs to understand they may have seen specific cases where it's not gotten worse and if people ignored it, but statistically, that is what we're dealing with. So in my case, it's just going to get worse. You don't want to get surgery because it'll just knock out one of these areas and leave the others. And lifestyle is the best answer for back pain. This is Dr. Christopher Maloney. Thanks for listening.